Hi everyone, my name is Margaret Falcon. I'm Head of Learning Development at Mirrors organisation. We support people who have learning disabilities, and we also have a care respite service and newly going into mental health service as well. I just want to take the time to talk about the All Wales Induction Framework for Health and Social Care Managers. But first of all, just wanted to explain why at Mirrors a really good induction is so important to any new manager coming into Mirrors or assistant manager. A really good induction must be a robust induction, and it must cover the breadth of the responsibilities that those managers are expected to carry out. Also, it's really important that managers are given the time to familiarise themselves with their working environment, with the role they're expected to do. So they need to build positive relationships, not only with their team, their peers, also with the people they support, and also with families and other professionals. So that is the sort of aim at Mirrors for a management induction. So when the All Wales Induction Framework for Health and Social Care came about, it was such great news to Mirrors. We were at a time in Mirrors where we were looking to review our induction process for management. We did have a separate one for managers and assistants. And in looking at the framework that's available from Social Care Wales, it just came at the real good time for us. And it fits really well with what our expectations are, what we want to give to any new manager coming into Mirrors. The All Wales Induction Framework for a Health and Social Care Manager is really a robust induction. It covers areas that are so important, as we all know, around leadership in person-centred practice, about effective teamwork and performance, about the manager being able to quality assure and be able to know about the regulations and laws, and also about safeguarding, and as well as that then their own professional development. So those areas which are covered in the induction fit so well with what Mirrors would cover in the breadth of what a new manager would do. So thinking of who would use that framework, all our new managers would use that framework. Our new managers coming in who are new to management to begin with, and also assistant managers. That's what we feel is good about it, bringing it together so an assistant or a manager would have the same experience, and that's what we want really. And we intend to use this framework for all those new managers, but you can also use it for managers that join us who've got a qualification that meet registration. We have an example of one manager who came in from children's services, and they sort of needed a top up, and that's exactly what the framework has done. It not only provides a general induction like I've just explained, which covers those important leadership and management skills, but it also now has various units. I think there's 17 in total, and we're going to be able to tap into that and use those units. So those managers coming in, especially that manager from children's service, who now needs to build up their expertise in adult services, and now we can go through parts of the induction they need to do to bring them up to speed, and parts then of the top-up units, so they become knowledgeable in that area. And it's really good we're allowed to do that internally. We got another manager who meets the essential criteria aspect of the framework, who they've got 80 credits in a qualification they've just done, however doesn't quite meet the registration requirements. And it's really brilliant now that we can offer them the option to go through top-up units. We can do that internally. They'll do the framework and then the top-up units required. And then that allows them to register with Social Care Wales as a manager next time round. So for me, that's one of the really good areas of this framework. I think the resources that's available that goes with the framework from Social Care Wales have been really easy to follow, and have allowed me and my organisation together, we've been able to review our induction framework and fit in this All Wales induction framework really well. I think just to finish off really and how good it is, it just reflects the level 5 qualification in health and social care. What more can you get? So new managers from day one, as part of their induction, are going to be starting off by collecting evidence towards their qualification. And just as a last note, really, I don't want to forget to mention the progress logs. They're so good to use because they got a section on it where the manager can record their evidence, what evidence they've collected for each section of their responsibility. There's a section for them to provide reflective feedback on how they've met each criteria of the framework. And then there's a section then for the manager to provide feedback. And at Mirrors, we've decided those progress logs are going to replace our current probation framework for managers because they fit so well. So that's all I can say. It's been really good experience. So thanks a lot, everyone.
The AWIF in Cartrevney has always been a successful programme for our support workers. It allows new employees to explore their role and gain new knowledge and skills within a safe learning environment. We expect the same outcomes from the managers of AWIF. Whilst this has a strong emphasis on continually improving and learning to develop core leadership skills, we also expect the programme to strengthen our management capacity and capability to plan and deliver high-quality services. The programme content is designed by our Head of Operations, Tracy Pears, and we also have in place the benefit of personal one-to-one development and mentorship support facilitated by our Quality and Compliance Manager, Jill Eastwood.
Jill, as the organisational mentor for new managers in Cartrevney, what do you feel is the benefit this experience brings to our new managers?
Oh, there's quite a lot, isn't there, really? I think the major one from my point of view is that it's an extra layer of support for them. Being a new manager, whether you're new to the role or new to the organisation as well, can be a really lonely place. So I think having that sort of dedicated time, that dedicated person that they can go to and just, talk about whatever they feel they need to at that particular time, really. So it could be reflecting on decisions made, reflecting on actions planned, planning for actions planned. It's a supportive time and it's a safe space for them to debate and reflect and decide, I guess.
Tracy, what's the most important factor built into your AWIF programme that you think is essential for your new managers?
I think it's the consistency that it brings as far as when we're inducting new managers, whether that be somebody that's had promotion, whether it's a completely new role, or they've done some management role previously. And it allows us to personalise it to make sure that it suits them, which I really like. We've had a recent manager that had some promotion and they really enjoyed that structure. But also what I like is that it allows our managers to bring in and to reflect on their practice, which ultimately will improve the quality of the service.